Hello everyone, thank you so much for all your appreciation in all previous videos. I have been really busy with my residency, but recently what I found out was I was doing a MAiD clinic in my residency. So I have got a clear concept of why is it legal in Canada and what is the reasoning behind it. So in terms of MCC QE1, remember you will get questions on MAiD because this is something legal in Canada and it is something that is being practiced here. So make sure you have a clear concept of it and I'll help you guide who are eligible patients and what are the conditions that the practitioner we need to know and what are the processes that a person needs to go through before having qualified for a MAiD, right? So in terms of MAiD, in terms of QE1, you need to know all these things. So I'll let you guys know what exactly is important for QE1 perspective. In terms of NAC OSCE, MAiD itself is not something that they would give you as a station, but they may incorporate MAiD in an elderly population. A patient may come up with a debilitating condition and they are asking for MAiD. So you need to explore why they would want to have MAiD, what are the conditions they're going through, how is it affecting their functionality, and then you will rule out the psychiatric or medical conditions, any mood disorders if they're going through, if they have any family support, if they're going through elder abuse. So ruling all those things out and also like showing that you know an eligibility criteria for MAiD. I've never seen anyone having a MAiD station in Nakoski, but you need to know the eligibility criteria at least to make sure that you're knowledgeable on that. And if in case it comes, you're able to educate your patients, right? And also refer them to a MAiD clinic, right? That's how it works for Nakoski if it comes. In general, for QE1, you need to know the eligibility criteria. So the most important, not the important, but most relevant resource, if you need to read up on MAiD, is Health Canada website. This is what I have here. So let's talk about what MAiD is. MAiD is a process that allows someone who is eligible to be able to receive assistance from medical practitioner in ending their life. And to end their life medically, they need to qualify for specific eligibility criteria. And medical practitioner can self-administer the medication or they may prescribe the medication to the patient. So if they are either administering the medication to the patient, that is called clinician administered. The other one where the practitioner just prescribe the medication and patient does it themselves, that is called self-administered medical assistance in dying. Okay, now, moving forward, what are the drugs used and made? So they are the commonly used drugs which are used for nausea, pain control, and anesthesia. But the difference is that they are 1,000 times more in dosage as compared to what they are given usually to treat these symptoms. Let's say propofol is one of them that is given to administer MAiD. In terms of pain control, there are fentanyl that is given for pain control as well, but the fentanyl given for pain control is quite low as compared to that's the one that's given for MAiD, right? Now going on to the most important part of MAiD is the eligibility criteria. For QE1, you need to know the eligibility criteria. What are the eligibility criteria that a patient may qualify for MAiD? Okay, you will get questions on that for sure. To be eligible for health services funded by a province or territory or federal government, you may also be eligible if you meet your province territory minimum period of residence waiting period. So that's something important because if you're, let's say, living in a province, let's say you're living in Ontario, you've moved out to Alberta. Now in Alberta, the minimum period to get your health card, you need to be qualified to have your health card there. You need to have your Alberta's health card to be eligible to have made there in that province. So that's how it works. Okay, so you should be 18 years old and mentally competent. So age is one of the criteria. This means being capable of making health decisions for yourself. So the question comes, let's say if a patient is 16-year-old asking for MAiD, they're mentally competent, are they eligible? No, because 18 year is the age criteria for MAiD. You cannot assess it in terms of, let's say, patient is mentally competent, may able to make their own decisions, but they are 16, so they do not qualify because the age is 18. Okay, so that is different from the most common things that we usually encounter, like let's say if they are competent enough, they are able to understand their uh, medical conditions. They're able to make their own decision. Now they can, opt in or opt out for treatment. That's different. For MAiD, they need to be eligible at least 18 years and plus, and be mentally competent. Now, having a grievous or irremediable medical condition, that means, so this is irremediable conditions part, so let's just go through this quickly. That means have a serious illness, disease, or disability, that means stage 4, advanced state of decline that cannot be reversed, and experience unbearable physical or mental suffering from your illness, disease, disability, or state of decline that cannot be relieved under conditions that you consider acceptable. So that means any patient with, let's say, stage 4 cancer, any patient, let's say, with endometrial cancer, with any neurocognitive decline, with severe or severe stage of neurocognitive decline, dementia is another one, right? And having any condition that is irremediable, that is not treatable, and it actually is grievous. That means the patient is actually suffering from the illness mentally, and that condition is causing a disability to, and this state of decline to that person. Okay, so you do not need to have a fatal or terminal condition to be eligible for medical assistance in dying. So it doesn't have to be cancer all the time. It can be dementia, it can be neurocognitive decline, it can be, let's say, what are the most other, so cancer is the most common one, but dementia, neurocognitive decline, these are the most common one after cancer. Okay, if you have a mental illness along with other medical conditions, you may be eligible for medical assistance in dying. So, what are the mental illnesses? Usually, if a person have, let's say, if a person is having depression or anxiety, that person does not qualify for MAiD. Why? Because this is treatable, and it is not something that solely qualifies for MAiD. So, for mental conditions, they need to have a mental condition along with other medical conditions. Let's say a 60-year-old is having a dysthymia, which is a mental severe depression for 2 years, along with a other medical condition. That means he has neurocognitive decline, or he have Alzheimer's. So Alzheimer's along with dysthymia may qualify for MAiD. Okay, so you may be eligible for medical assistance in dying along with other conditions, not primarily depression only, right? Let's say if a patient has COPD, if a patient has dementia, if a patient has depression, then that person may qualify for MAiD, because COPD is affecting severe COPD, I'm saying. Okay, severe COPD impacting his breathing, having him difficulty breathing, he cannot do his chores, he cannot eat because of shortness of breath. Let's say he's having dementia, which itself is another medical condition that can become severe and make them disabled, and along with that depression is there, then they may qualify if all these conditions are contributing to his functionality. Eligibility is always assessed in an individual basis, takes all relevant circumstances into account. However, you must meet all criteria to be eligible. So this you need to know the criteria. Irremediable condition, what are those? It doesn't have to be just depression, it doesn't have to be just cancer, it can be a combination of everything, or it can only be a straightforward stage 4 cancer or stage 3 cancer. Okay, so it depends, not everybody is having the same criteria or same condition to be able to qualify for MAiD. So that's that. Now we were going back to the eligibility criteria. The first one was they may be able to qualify for provincial health services, right? You need to have the funded by the province. You need to have your health services funded by the province. Number one, you should be 18 years or above, along with mental capacity. Third one is irremediable or grievous condition that we have discussed already. Make a voluntary request for medical assistance in dying. The request cannot be result of outside pressure or influence. So whenever you do MAiD, or whenever a physician is doing a MAiD, they need to make sure that they talk directly to the patient. No family member can come up and say, "Oh, my father might need a MAiD, or my mom might need a MAiD." No. In QE1, you may have tricky questions where a son is saying that their father is in a palliative care, and now a son is asking for MAiD for their parents. No. So make sure person should voluntarily request for MAiD. No one else can ask for MAiD, even if that person is power of attorney. they cannot request for MAiD in that case, right? There are some nitty-gritties to those things, but you straightforwardly need to know that a person needs to voluntarily ask for MAiD, okay? No outside pressure is acceptable in this case. Give informed consent to receive medical assistance in dying. So be able to consent, be able to voluntarily request for it, 18 years and above, mentally competent, have grievous irremediable condition, should have the fundings by the province, okay? Generally visitor to Canada cannot not eligible for medical assistance in dying. I know people who are living in United States, and because that might not be eligible there or in the state that they're living in, so they usually come back to Canada or to certain countries to have MAiD. So this is just out of context to share like how strict the rules are for MAiD, right? Informed consent, that means a person should be able to give consent, is when you give permission to receive medical assistance in dying. After you receive all of the information, you need to make your decision. This includes your medical diagnosis, available form of treatments, and available options to relieve suffering, including palliative care. So it depends. Like whenever you need a MAiD, you need to know about your diagnosis, you need to know about your treatments, and you need to be able to um, have available options to help you relieve suffering, including palliative care. If you know all the information about that, irrespective of that, you want to make a decision about MAiD. So that's what it is called, informed consent, that you're aware of your options, but you're going for a an option for MAiD. So that's how you say that this is an informed consent. You must be able to give informed consent both at the time of the request, immediately before receiving medical assistance in dying, unless special circumstances apply. You can withdraw your consent at any time in any way. Very important concept that I'm going to give you today, that let's say if a patient has consented for MAiD previously, so the consent has to be taken two different times. One, when patient is requesting MAiD, so you will have them sign that they're requesting it, and now after you've informed them about the treatment options and you've discussed everything, and at the end they may sign the request, and then they also have to sign, or they have to also consent before the MAiD process is being done. Why? And in special circumstances, those are the special circumstances where you will be tested on. Let's say a patient has given a consent for MAiD, that patient is not conscious now. What are you gonna do? So in that case, there's a special circumstances where they may waive for the final consent, right? So we'll discuss about it right in few minutes, okay? So you can withdraw your consent at any time in any way. So patient can withdraw their decision or their consent anytime. There's no pressure, no rush in that, okay? Making a request, regardless of location, you can request MAiD if you're eligible. If you're experiencing a lot of pain, suffering due to medical condition, talk to your physician nurse. You can discuss option related to circumstances, your possible interest in medical assistance in dying. How and where this service will be offered is determined by institution, province, territories, and the organization that regulates health professional. The role of province and territories, policies and procedures may vary depending on where you live. Provinces and territories can create health related laws. Rules that affect medical assistance can include data information collection, the use of specific forms to fill out special medical. So every provinces have their own forms to fill in regarding MAiD, but this is not something that you need to know. Procedural safeguard, before a medical practitioner administered MAiD, they must satisfy certain safeguard. These include making sure that you have two independent assessor. So anytime a person requests for MAiD, there are two different independent physicians who assess them. They have no benefit or no personal interest in assessing them. So two independent medical assessments should be done. That means that one person goes in, they talk to the patient, they know like why do they need it, and if they qualify for MAiD. The second person goes in again, they talk to the patient, they check if the patient qualifies, they know their struggles, and then if that makes sense, then they qualify them. And then the process comes where they decide the date, they decide the location to administer MAiD, and then that they take the patient from there, right? And the third assessment is where the MAiD is administered. So 3 appointments at least required for MAiD procedure. Make a written request signed by an independent witness. So an independent witness should sign a written request. Know that you can withdraw your request at any time. Patient should be aware of this right. Provide final consent before receiving medical assistance in dying. So that's what we discussed earlier. But there is a exception to this rule. Give advance consent if applicable. So this is something that we are about to talk in just few minutes now, and this is something that I really want you to have a good concept on. They must also meet extra safeguards in the event that your death is not naturally foreseeable. Medical assessment. When you make a request for medical assessment, and two independent medical practitioner, nurse, or a physician or nurse must assess it. Your medical practitioner must make sure that you meet all the eligibility criteria. The second must provide a written option confirming that you're eligible. So that's what I just told you. The medical practitioner providing an original assessment, the one giving the second opinion, must be independent. This means that knowingly benefit from your death, hold a position of authority over the other, be connected to the other or to you in a way that could affect their objectivity. So, a witness or an assessor should not be benefited from your MAiD. So, those are the people who can consent for you, right? So, assessors are the physician, they should not be linked to you, they should not be your family members. So, nothing to do with that. And then the witness who's signing that you're going for MAiD cannot also be your family member. Okay, it can be someone, can be your neighbor, can be someone who is not benefited with your death. Let's say if you're dying, your property is not going to their name, or they're not benefited. Your family cannot be your witness. It has to be an outside person. Making a written request. You must sign a written request that says you want to have medical assistance assisted death. The request must include your signature confirming your request for medical assistance dying. If you can't write, another adult can sign the request on your behalf under your clear direction. This adult must be 18 years of age, understand what it means to request death, not benefit from your death. If, for example, they must not be and hire to your state. So a written request can be made if you cannot write, right? Someone else can do it, but for someone else to be able to do it, they should qualify for this criteria. Written request must be signed and dated before one independent witness, who must also sign the date and date the request. Who can be the witness? The role of independent witness is to confirm the signing and dating of the request by the person requesting MAiD. That the person requesting MAiD understand what they're signing, and they should be 18-year-old and above. Can be paid professional, personal, or healthcare worker. Must understand what it means to request MAiD. To consider independent means that witness cannot benefit from your death, be unpaid caregiver, or be an owner or operator of a healthcare facility where you live or are receiving MAiD. So this is what you need to exclude. For anyone you're asking to be a witness of MAiD, they need to qualify for this criteria. Okay. Withdrawing your request, you can withdraw anytime, even right before you're getting MAiD, you can withdraw your request. So no problem in that. Final consent immediately before receiving MAiD. So we need to get two consents. One is the informed consent that we are getting while we are telling the patient about what is MAiD after they've requested it, and the final consent is when we are administering MAiD. Just before that, we ask the patient if they consent for it again. Okay, so you must be given an opportunity to withdraw consent, affirm your consent if you do not wish to withdraw it. An exception to this requirement is possible if you have a waiver of final consent. Here comes the concept. Trust me, you need to learn this. For anyone gonna do a QE1, they need to know what is waiver of the final consent. So I have already I'm talking about the fact that we need to have two consent. One is informed consent, second is final consent. Informed consent is after they know about everything, they're giving an informed consent. The second one is the final consent. So let's say if someone has given consent for MAiD earlier, and now they think that they now at the time of MAiD they're not eligible for the final consent because they have lost their consciousness, or they're in a condition where they can no more speak about it. So in that condition, they may, if let's say it is foreseeable for them to die, and as a practitioner, let's say if someone, let me make it simpler for you. If there is, let's say, a 60-year-old female who wanted MAiD because of end stage cancer, and now she has consented for it at the time when she requested it. Now she has asked for MAiD, let's say, at the end of the month, because she needs to complete some of her tasks before she dies. So at the end of the month, let's say a week before or 2 weeks before, she loses consciousness. So now she cannot consent for the final consent. Why? Because she has lost her consciousness. Now what are you going to do as a practitioner? So it is your responsibility to ask and let the patient know if they want to waive the final consent. So if they want to sign the waiver of final consent, that means they will sign that we don't need to consent. We don't want to do the final consent. We irrespective want to die, and irrespective of our consciousness, we waive the final consent. That means we take off the final consent and we don't want to give the final consent. This is the first and final consent for us. So if they sign that form, they are eligible to get MAiD irrespective of their conscious level. They are conscious or unconscious, they would still qualify for MAiD. So that's an exception. Okay, I hope that's making sense to you. If you guys have any question about this, you can write down below, just so I can explain it further in a video or a short, because this is the most important thing for MAiD for anyone who's going to take QE1. So of the final consent, an exception to this requirement is possible if you have a waiver of final consent. You have waived the requirement to provide consent just before you receive medical assistance in dying, only if, so there is a condition, your natural death is reasonably foreseeable. That means, let's say I said stage 4 cancer. If someone has a stage 4 cancer, they can waive the final consent. Why? Because their death is naturally foreseeable. They may die in 6 months, in 1 year, so their death is already expected, so they may die. So that's only when they can waive for the consent. Not anyone with depression, or not anyone with any diagnosis may waive for the final consent. There's also condition for these things. Okay, while you had medical decision capacity, you were assessed and approved to receive medical assistance in dying, your practitioner advised that you are at risk of losing capacity to provide final consent, and you made a final arrangement with your practitioner to provide consent in advance on your chosen date, if you no longer have the capacity to consent on that date. So what is that? Let's say if you lose your decision making capacity just before getting MAiD, or maybe few days before getting MAiD, so you cannot consent, you cannot not get the final consent. So that's when, if you sign the waiver, you will not have to do the final consent, and the practitioner is eligible to give you administer you the drug, right? But let's say for this to happen, you need to have the debilitating condition, or you need to have a diagnosis that makes you eligible, that irrespective of whatever happened, you will die, right? So let's say this has to be in a serious condition. Let's say if you have a cancer, you have a severe dementia, neurocognitive decline, you have, let's say, a lot of comorbidities that someone or a practitioner may expect you to die within some period of time, and you want to die before that. So you can sign a waiver and you can make that decision that you just need to consent once, and you don't need to give the final consent. I hope that's clear now. Any arrangement for those for the waiver of final consent will be considered invalid if at the time that you are to receive medical assistance in dying, and you no longer have capacity, demonstrate refusal or resistance to administration of MAiD by words, sounds, or gesture. Okay, so it would be invalid if during the time you no longer have capacity and you demonstrate refusal or resistance through your action. Reflexes and other types of involuntary movements do not constitute refusal or resistance. Examples of involuntary movements include response to touch and insertion of needles. Let's say if you move your arm, and a little bit of jerk would not be considered as a refusal, and you may still qualify to get MAiD. Okay, all right. And you cannot waive for the consent if you don't have you have no longer capacity while you're consenting for MAiD, and demonstrate refusal or resistance to administration of MAiD by words or sounds. Advance consent: in case of self administration, you can make an written arrangement with your practitioner so they can administer medical assistance in dying in event of failed self-administration. So you can also write that in future, in advance, that in case I don't do it myself, or I'm unable to do it myself, you can do it for me. So you need to get that in written from the patient. This arrangement allows for clinician administered medical assistance in dying if there are complications during self administration request where your natural death is not foreseeable. um, so in this case, requests were made determine that your death is not foreseeable, that are extra safeguard that must be must. There are two different types of MAiD. Let me tell you here. So let's say if we see this chart in Canada, medical assistance in dying law in 2021. So they made it a little straightforward where they said that if you have the eligibility criteria, then there are two things. One is existing in each safeguard for eligible foreseeable person. Let's say if their death is foreseeable, simply let's make it like stage 4 cancer, their death is foreseeable, so they need a final consent or a possible waiver of final consent for eligible persons to under certain circumstances. Someone is having stage 4 cancer, their death is already foreseeable, they just need to sign an informed consent, and also they can waive for the final consent. But let's say for someone whose death is not foreseeable, but they're having MAiD because their quality of life is compromised because of the multiple conditions that they're having. So they need a final consent to be provided before administration of MAiD. So this is different from this. Why? Because one of them has their death as foreseeable death. One of them doesn't have their foreseeable death, so they need to consent twice. I hope that makes sense. Someone who's not seen as that they may die in some time, they need to consent twice to get MAiD. Whereas someone whose death is foreseeable will only need informed consent, and they may waive for their final consent. Okay, so that's how it is. So this is something that is simple. You can read this up, and that's the same concept that I have explained you already. Medical practitioners and nurse practitioners can be the assessors, providers, right? Not all healthcare providers are comfortable with MAiD. Federal legislation does not force anyone to provide or help with MAiD. So you don't have to do as a family physician. You can do if you want, but it's not something that you have to do. It's an option in case anyone in NAC OSCE may get a station. So in case you can just say, I'll refer you to MAiD clinic. So that's that. I hope this helps you in general to have a clear cut idea of what MAiD is in Canada. For me, honestly, until I started my residency, I wasn't clear what is a concept of MAiD, but I knew that this is something that existed. But after doing MAiD clinic, I had this opportunity to learn that this is something legal in Canada because to reduce patient suffering, when you see patients in clinic, in MAiD clinic, you really get to see how depressed they are, how their quality of life is impacted because of their illness, and how they feel that they are burden on their families. So every case is individual, and have a clear cut concept of what MAiD is. And this is an emotionally exhausting process for sure, as a physician, as a patient. But then sometimes this is something that as a physician we may encounter, and for sure we will encounter in Canada, because this is legal and patients are aware of their rights. So yeah, I hope this video has helped you, and if you have any questions about MAiD, make sure you comment down below on that. For people who are going to do their QE1, they need to have a really good concept of eligibility criteria. They need to have a good concept of foreseeable and unforeseeable death, and also if let's say if a patient is dying, they have said that they need MAiD, and now their son is coming up and asking that they may not that they should not get MAiD, then that doesn't mean anything. Why? Because the patient was already having a debilitating condition, that patient consented for it, and now if the son is coming, he cannot say that. Why? Because the father might have already signed a waiver. So in case a patient has signed a waiver, no one else can say that the patient shouldn't receive a MAiD. So this is a clear cut concept that you need to have for QE1, and I hope it helps. um, good luck to all of you, and let me know if there's any specific topic you would want me to make videos on. This was a very challenging topic to talk about, but I wanted to talk about it since I recently did a MAiD clinic. So yeah, good luck to all of you. Thank you for watching.